changing the landscape of healthcare through biomarker testing that could revolutionize how doctors diagnose and treat various medical conditions.
We go on the record taking a look at what this means for patients, healthcare providers, and the future of personalized medicine.
From WPBF 25, this is On the Record with Todd McDermott and Nathalie Pozo.
Good morning. Florida Medicaid and state employee health insurance plans will now cover biomarker testing starting later this year. So what is it? Joining me now to explain it all and go on the record is Dr. David Felt, an obstetrician and gynecologist specializing in anti-aging medicine. Doctor, thank you for being here. We should add that the biomarker equipment is right here. Demonstration to come, but first, tell us what biomarker testing really is.
The goal is to eat more fruits and vegetables. And I want to congratulate our governor because he signed a bill, as you just beautifully said, that's really incentivizing physicians to spend some time talking about prevention and nutrition, which I've done since I came in '78. But what really changed was the advent of this instrumentation, which kind of looks kind of small, but it's big in health.
Let's talk about what the testing does and how it improves how a doctor could diagnose and treat a condition, a disease, several different factors.
50 years of research, over 50 years of research from the NIH and other studies, confirms that vitamins don't work. Antioxidants are the key, fruits and vegetables. So with that research, it's all well and good, but the question is, are you eating enough servings of fruits and vegetables? But if you measure 100 Americans on this, only one's good. So what is this measuring specifically? Over 20 antioxidants. Yale did a 10-year study on this instrument and said every healthcare professional, and this was in 2013, every healthcare professional should have this. For me, I've always been educating patients to nutrition. But the tide really turned when my wife, Polly, and her business partner, Kathy Petrillo, dragged me down to look at this, and I was very skeptical.
But you embraced it.
I embraced it after a while, and that's the problem with the average physician. What drove me really to it was the ability to measure on day one, put people on products, which we're not going to talk about, and 60 days later, see the needle move. Once that needle moves, that's the aha moment. Now, what does the research show? Talk about any disease, lupus, rheumatoid, high blood pressure, cholesterol, pregnancy-induced hypertension. Antioxidants don't cure, don't prevent cancer, only it's a better model. So what we found, and I didn't know this when I started it, 80% of my patients are taking something. And 99.99% of what they're taking is unadulterated, worthless product.
Let's see how I've been doing, because
Yeah, don't get scared.
let's go into showing what performing the biomarker testing is, and I'll be the guinea pig.
So what this says, the patent on this says that we are measuring risk factors for cancer and other diseases.
Okay.
That's a pretty powerful patent.
Yes.
You think?
Yes.
So what this is going to tell us is in the last 2 months, how many servings of fruits and vegetables you're actually getting. This is a report card for your health.
Man, I'm glad I ate vegetables today.
Remember, 2 months. So the average American scans at 1 serving of fruits and vegetables. One.
Per day?
Per day.
Okay.
Yeah. All right. Wow. I'm impressed.
Wait, am I over 1?
I'll show you. You want to show that on
All right. I don't know if they can see this.
Can
but
they see it?
I will turn it around.
So let me tell you what you did. You scanned at 42,000, where the average American, and here's your grade.
Okay.
The average American scans here a D.
A D.
If I scan 100 people in America, one's an A, two's a B, and everybody else is getting 6 servings or less of fruits and vegetables. And that puts you at a 5 times greater risk for cancer, diabetes, heart disease, etc. But let me say what, a lot of people don't understand what this is. The patent on this states, again, we're measuring risk factors for cancer and other diseases. Harvard has a 5-year study on breast cancer. The higher antioxidant levels, the less risk for breast cancer. So basically, to make it very simple, we're doing the patients a favor by saying, you're spending $60 billion a year on products that are not effective. They're not absorbed, and they're not complete.
All right.
We'll give you a chance to see where you're at and make a change.
Let me ask you one quick question.
You can ask me anything you want.
The final idea here is nutrition, personal habits really influence how this biomarker testing, the results that you get, correct?
I'm so glad you asked that, because this is really a behavior modification tool. When I have a little 15, 16, 20-year-old come in with their parents, and these young ladies put their hand on that scanner and they score an F, I'll turn to the patient, I'll say, you want to tell mom and dad your habits? Well, what do you mean? Do you want me to tell them they're smoking or they're vaping or both? And this really shows the free radical damage that you're getting from this.
So much more to talk about, but we're out of time for this segment. Dr. David Feld, thank you so much for being here. I appreciate it.
Thank you so much for
By the
having
way,
me.
didn't hurt a bit. Next, my co-anchor Nathalie Pozzo talks with an expert about what biomarker testing can mean for cancer patients. That's when On the Record returns.